Okay, so for this question, we have a 5-year-old child who's brought to the clinic due to lack of sensation in his right forearm and hand. The child cannot extend his wrist and fingers, and it started after his arm was pulled by his mother while they were playing. So exam shows loss of sensation over the extensor region of his right forearm and hand. What nerve is damaged? So A, we have the axillary nerve, B, radial, C, musculocutaneous, and D, long thoracic. So I'll let you answer the question and then I'll explain. So the answer is going to be B, radial nerve. And so for this one, so this specifically is called radial head subluxation. So it's colloquially called nursemaid's elbow. So essentially what happens is when you have a sudden pull on an extended pronated arm, it's going to sublux, so partially dislocate the arm, and then it's going to impinge on the radial nerve, giving you the symptoms that this patient had. So they're going to have paralysis of the extensors of the forearm and hand. That's why they can't extend the fingers, and it's a very simple solution. You simply hyperpronate the arm and then pull on it, and then it will help put the elbow back into position, and the pain will instantly go away. The only thing to note is if there's tenderness at the site, then it could be indicative of a fracture, and so a x-ray of that area might be needed just to rule that out. And so next we have axillary nerve. And so for this one, we have the deltoid and teres minor. The axillary nerve innervates these two muscles. And so if you had injury to it, you would have loss of lateral rotation and then abduction and then loss of sensation over the deltoid. So moving on to the musculocutaneous nerve. So this one is responsible for elbow flexion. And if you had damage to it, you would have impaired supination. This also controls sensation over the lateral aspect of the forearm. And then finally, we have the long thoracic nerve. So for this one, we have the serratus anterior. And so this causes winging of the scapula if the long thoracic nerve is damaged. And so all that means is that the scapula, which is the shoulder blade, would stick out. So just to recap, essentially when you have a child being brought in and they're holding on to their arm really tightly and it's in a pronated position, you should think about nursemaid's elbow, especially if the history that they give you is that the parent or their sibling pulled on their arm very hard. Then you can start considering this syndrome, and then exam findings would include loss of sensation over the extensor region of the forearm and the hand, and so that really clues you into this syndrome, and then you'll know that it's the radial nerve being affected in this case. So I hope that helped, and thanks for watching.